getting at for rural providers and are getting at some of those difficulties you've mentioned.
Okay, I'm out of time.
Appreciate you being here. It's no secret that for many reasons I did not support the President's health reform bill. Despite my long-term interest in reforming our nation's healthcare delivery system to reduce costs and, of course, improve quality, I was concerned with the creation of a new bureaucracy known as the Centers for Medicare and Medicaid Innovation, CMMI, and giving them $10 billion in taxpayer funds with no strings attached. We have now held 2 hearings in the committee where we have heard from the public and private sectors about interesting ways they are working to improve the delivery of care. I, for one, wholly support the private sector working among payers, providers, and patients to come up with solutions that best fit their communities in order to achieve more efficient and higher quality results. I have heard repeatedly from my Democratic colleagues that CMMI is tasked with letting, quote, 1,000 flowers bloom, unquote. What I really wonder is if this is simply a euphemism for barely controlled chaos. Dr. Gilfillan, I don't envy you your job. The administration expects you and your staff to overhaul the way health care is delivered in this country and to do it quickly so that people begin to believe their claims that Obamacare will save money. I'll make a prediction. Come the first part of next year, this is going to be utter chaos, and people are going to realize what a tragic mess we're in because of Obamacare. However, despite the claims that Obamacare will save money, I'm quite confident that Obamacare will only increase the cost of health care in this country. And I believe the evidence overwhelmingly supports my position. And we'll all find out at the beginning of next year when all of these things trigger, including 20,000 pages of regulations. With that said, I do think there is merit to trying to change the delivery of care and to focus on greater coordination of care, reducing hospital admissions, and providing better outcomes to patients. I am concerned, though, that there is confusion and a clear lack of focus at CMMI. The Government Accountability Office, GAO, reported in November of last year that while you have taken steps to coordinate with other offices at CMS, more work needs to be done to make coordination more systemic. It seems to me that CMMI would function best if it would pick a few initiatives, such as accountable care organizations or bundled payments, and really devote the time to those initiatives to make sure they actually work and have the intended consequences of lowering costs and increasing quality and efficiency. Instead, I hate to say this, but I fear that you are trying to do too much at one time. Coordination among initiatives that have similar goals is something the GAO has highlighted as a concern. For example, the Innovation Center's Partnership for Patients model and CMS's Quality Improvement Program have a similar goal: to reduce the rate of preventable hospital-acquired conditions and 30-day hospital readmissions. Both models contract with organizations to disseminate interventions to hospitals and perform virtually identical functions. That sounds like something that could be consolidated. I hope that CMMI takes the time to really study the impact of initiatives both while they are going on and at the end of demonstrations so that we know if they work and how well they work before the initiatives are offered to more providers and patients. Since the GAO report indicated that in most cases it will be 3 to 5 years before CMMI and the taxpayers know if these initiatives achieve their anticipated savings, it is critical that they be reviewed to determine whether they meet their stated goals. And as you know, in the past, the Congressional Budget Office has shown us that most demonstrations don't actually save the taxpayers any money. Finally, I wanted to raise concerns about the number of high-salary staff that are employed by CMMI. In addition to spending billions on the CMMI projects, GAO noted that nearly half of the 184-plus members of the CMI staff are paid at the highest levels of the federal pay scale, which stands in stark contrast to other areas within CMS, including very expensive treadmill desks. In a post-sequester world, where White House tours are being canceled and Easter egg hunts are being threatened, you can imagine why American people would take a very cynical view about federal employees being furnished with $1,000 treadmill desks. The federal government absolutely cannot afford to pour money into things that don't work. Our priority must be very clear. We need to make government as efficient as possible. And we do not need bloated bureaucracies. We do not need duplication of effort. And we do not need an increased morass of regulations and platitudes. And we do not need taxpayer dollars being spent so that staff can work at treadmill desks. What we do need is a clear strategic plan to improve quality and reduce costs. We need specific goals with specific direction to achieve those goals. We need the right people with expertise in these areas to develop targeted approaches that can be tried quickly, studied, and assessed for measures of success. Now, Dr. Guthelen, you know that last year I sent you a letter asking for an accounting of what your office has been working on, how much money has been spent, and more importantly, how that money was spent. It took you more than 6 months to reply to my request. And let me repeat that again, 6 months. And that's, to me, entirely unacceptable. I hope I'll have your commitment today that that type of behavior will not be repeated, and all members of this committee will be given timely and complete responses. And I would hope that you would do that. Can I get a commitment on that?
Senator, we deeply regret the length of time it took to respond to your letter. It was the first such letter we received. It took us time to develop what we felt was an adequately comprehensive report addressing your questions. It certainly is our intent to be much more.
Well, then send me a letter, then call me and say, look, we need a little more time here. We'll be happy to give you a step-by-step approach in accordance with what we worked on, etc. But don't let us sit there for 6 months without having a response. We're getting too much of that in this administration, where they just ignore what people up here ask them to give. It's too pervasive in this administration, and we've got to stop that, or there's going to be just unholy war up here. Well, as you can see, I have a number of concerns that I don't have time enough to go into right now, but I do want to thank the chairman for convening this hearing, and let me turn to Senator Casey at this point.
I want to thank the ranking